Hello, my name is Muhammad Imran bin Muhammad Iskandar. I am currently studying in my 6th semester in a program called Bachelor in Environmental Health at Management and Science University, Shah Alam. The video is made for a class project in a subject called Environmental Health Promotion and Risk Communication. The mini project requested that I make a video on the topic of crisis communication and select an example of a crisis to use to explain the number of phases involved in the process. So what is crisis communication? Crisis communication is a process incorporated into the strategic management of a crisis that is about to or currently being faced. It involves giving information related to the emergency situation towards specific groups or demographics that are affected by the crisis. The information being reported aims to protect an organization's reputation, maintain trust, minimize the crisis' negative impacts, provide accurate information, train crisis management professionals, communicate strategies, maintain transparency, debunk misinformation, reduce panic and confusion, educate the public, etc. It should be noted that when it comes to explaining crisis communication in terms of its stages, it can be a bit difficult. The number of stages and the aspects of each stage varies depending on the problematic event being addressed, plus many of the aspects in each stage tend to overlap one another. However, for the purpose of this video, I will be breaking down the communication process into 3 general stages, the first of which is called the pre-crisis phase, the second one is referred to as the crisis phase, and the last stage is named post-crisis phase. To elaborate on these stages, I will be using a hypothetical environmental health crisis to illustrate how crisis communication is implemented into addressing it. And the environmental health problem I chose for this video is the prevalent case of unsafe drinking water. Unsafe drinking water refers to a community's or a country's water supply being rendered unsuitable for drinking purposes, along with other uses possibly. The first of stages of crisis communication is the pre-crisis phase. This phase occurs before any noticeable or measurable signs of a crisis happening or starting to happen. This phase is characterized by the existence of anti-crisis personnel which aim to counter any negative impacts coming from whatever specific upcoming crisis. Crisis communication is used to explain plans that are made to counter potential crises, educate or train personnel on how to counter a specific crisis, update and monitor on whatever factors indicate the emergence of a hypothetical crisis, and communicate between necessary groups or organizations on these updates from monitoring schedules. To put this in the context of unsafe drinking water, workers are employed in fields relevant to the prevention and mitigation of unsafe drinking water cases such as water supply facilities, hydropower dams, sewage treatment plants, hospital care, water quality inspectors, water quality education, law enforcement, news agencies, etc. During this phase, communication is made on reports of potential damage to water infrastructure, contamination of water supplies, inspection of water quality based on various parameters, possible cases of non-compliance to water quality regulations, and training of water quality personnel. On the other hand, news agencies, the state or federal government, educational institutions, and online websites can inform the civilian population on the health symptoms related to untreated water. Wastewater is supplied and treated, regulations imposed to safeguard drinking water, negative effects of wastewater on the environment, and may even how to personally treat their water. Moving on to the next phase of crisis communication, known as the crisis phase, this is when the first signs of a crisis happening or beginning to happen are noticed. The second phase follows the preparations that were made in the first place. As soon as any indication of any oncoming crisis is noticed, any members involved in the anti-crisis personnel will immediately notify other relevant organizations on the possible threat. Crisis communication is used to disseminate information that was and currently is being received, lay out the outcomes of the crisis, and coordinate plans that were prepared initially or during the situation. In the case of unsafe drinking water, the first notice signs of the drinking water being rendered unsafe to drink are reported to other related authorities. The situation is informed to both the authorities and the general public based on the accurate information collected, refutation of false rumors or misinformation, possible causes that made the water undrinkable, what is to be expected in the future, how it affects the people, how it affects the environment, executing plans to combat the problem, and other topics I possibly didn't mention. The general civilian population will certainly be advised on buying water or beverages to drink, not drinking the unsafe drinking water, perhaps using the unsafe water for alternative uses, seeking medical appointments, and maybe also being allowed to try to treat the drinking water. The last stage of crisis communication is titled post-crisis phase. In this time, the crisis communication process continues in the aftermath of the crisis or once the crisis has seemingly ended. This may be confirmed when the impacts associated with the crisis may stop manifesting. Around this phase, an overview of the events that took place during the crisis will be discussed and completed. Plans that will be used to prevent or reduce cases of the crisis repeating in the future will be explained. Discovered causes of the crisis will be revealed, and usually messages of condolences and assurance towards affected individuals will be given. After a water quality crisis, the potential causes of the drinking water being made unsafe discovered and broadcasted will inform the water treatment committee on what solutions need to be in place to ensure that the drinking water quality doesn't become bad as much as possible. People who were negatively affected by the water crisis health-wise, or those who have friends or family members that suffered or died from it, will typically be given messages of grievance and compassion to feel safe and secure again. The events documented during the water disaster would feature data including casualties from the crisis, list of health symptoms from unsafe drinking water, areas that had unsafe drinking water, etc. Alright, we have finally reached the end of the video. Before I finish, I just want to let you know that this video is not easy to make. The most challenging part I had to do was trying to get the correct version of the crisis communication process online and translating that process into how a case of unsafe drinking water is managed. Other parts felt tedious and exhausting for me personally. It gave me a bit of a headache trying to edit the video and it was done on Canva. However, I still found it motivating to do since it has allowed me to become a bit more disciplined and be better capable of thinking for myself. I have persisted in planning out the video and trying my best to make it as visually appealing as possible. Besides that, I hope you are able to enjoy and understand the illustration of how crisis communication is technically used in confronting incidents relating to unsafe drinking water. As you can see, the planet would likely be worse without such a thorough process, and more lives in the environment would be at higher and immediate risk. Thank you.